Good morning. Can you hear me with the mic? All right. Well, we'll just start. Good morning. Sorry we're starting a few minutes late. We wanted to get a second mic so people don't have to keep coming back up and forth for the panel. Good morning. I'm Guy Costantino. I'm with the Cayuga County Community College Foundation, and we'd like to welcome you to our second to last panel for the 15-16 year. We're dealing with a somewhat familiar topic this morning. I'll get into in just a moment. I would like to make two quick shout-outs or announcements. The first is to Susan Martini, our new Fred Atkins Community Award. Has done a wonderful job remembering Fred Atkins, who was just a super gentleman, and I know she worked with him for many, many years. So well-deserved. Congratulations. And the other one is to Mr. Lucky, Chief Diger, who is our new acting city manager. Many of you have not met him. Please, if you would stand, Chief, so they know who you are. He has promised to fix every pothole, time every light, and lower your taxes all in the next 6 weeks. So we are dealing with a subject today that we dealt with last year with a panel discussion on the issue of heroin. As we all know, the numbers have not gotten better, not only in Auburn and Cayuga County, but throughout central New York and the nation. Two numbers, the only two numbers I'm going to give you, came up last month when we were at the college with Congressman Catco. Two numbers that were tossed out. The first one is that there's been a 300% increase nationwide of the number of deaths attributed to heroin last year, Congressman mentioned. The other one was a number from Chief Diger, who said that his department, fire department, last year had over 200 calls for overdoses in the city of Auburn. Those are startling numbers. So we thought it was important, again, to talk about this subject. And we have a panel that's really going to have a conversation about a lot of different areas and pieces that go with this. We have a very active group with the HEAL group that many of you have read about or seen or participated in, and that's the Heroin Action League HEAL. But we've asked Kevin Harris of CHAD, who was with us at our last panel. He's the Executive Director of Confidential Help for Addiction that is located at 75 Genesee Street. Monica Taylor, who was with Krause, who has been dealing with this issue most likely more than anyone in the sense of the floodgates are open and she is trying to solve a problem with a very limited amount of resources for a 17-county area through Krause. We have Kevin Jones at the HEAL group. He is their executive director. And then we have Lynette Wilson, who is a parent who's been a great advocate over the last several years about this subject. So we'd like to welcome you all to the panel. Go ahead. The first thing that we would like to do is almost as if this were a serial, that we'd like to say where we are now compared to where we were several months ago when we last had the panel here. So the link there is Kevin Harris from CHAD, who along with Under Sheriff Stowell and Ray Mazzari have been a triumvirate who have been all over the county for now 3 or 4 years dealing with this subject. So I turn it over to him and then we'll move down the panel on different subjects. Mr. Harris.
Hello. Let me know if you can't hear me. In essence, if you want to follow up, there's been a lot going on. One is that the HEAL group, which Dell will talk more about, has done a tremendous job in going out to the schools and doing community awareness. If anybody has not seen that, you really ought to check it out. The Drug Free Coalition, which I chair, has attacked this hard and is working on, put in a grant for a community prevention educator. We're really looking at trying to, logically what you want to do is stem the flow. You stem the flow by getting people to not use. So the goal, I think, from the high school perspective is to try to get kids to make a choice not to use, and then hopefully put someone like myself and Monica out of business. We'd probably be glad to retire. But it starts there. So that's where the efforts, I think, have been focused recently. And I know there's more, because Kevin informed me there's more presentations. So I think by the time we're done, we'll have hit a lot of young people who we think have really responded well to it. From a treatment perspective, we have met with the hospital. Grace House, which is the halfway house, and Unity House, which is their parent agency. We've all worked together to try to come up with solutions. One is, and I don't know exactly where this is, but there's been talk of possibly an inpatient program opening up through the hospital. Chad and Recovery Counseling have sped up their intake process so people get in quicker. And the other thing is that we're working with Unity House on trying to do a stabilization program, which is really the missing ingredient, which is when somebody's in crisis, they really are not available at the hospital unless they have a medical condition. We're looking at creating a program that you would actually be able to stay here for a week or two, figure out what your needs are, and then get referred out to the level of care that's necessary. That would be huge because it means we won't lose people in that process of not getting them referred. So, clearly there's a lot of movement in this area. The other aspect is, I think we've been talking about this, but the lack of denial, which means I think this community has now wrapped its head around the fact that there is a very, very serious problem and people are dying from this. And one of the other things that we've learned over the time about the actual deaths is I think most of them, in talking to Sheriff Gould, have been related to fentanyl, not just the heroin. So what we've really got is some folks who really don't care if you live or die. I mean, I don't know if there is such a thing as morality or ethics in drug dealing anyhow, but what we're finding is even people who have not got a serious heroin problem but may want to try it may be the consequence of that hot bag that had heroin or some synthetic something in there. So clearly, the message is out, we're pushing hard, we've done a ton of these things, but the beauty is, in all the years I've been at CHAD, I haven't done this many speaking engagements ever. So that tells me that there's a reception to this. And what that means is you're listening, you're doing things, you're trying to do something different. And the beauty for me is to sit with the DA, the sheriff, everybody, and everybody on the same page going in the same direction, is how this is going to get addressed, because dealers have to get arrested, no doubt about it. Folks who are selling fentanyl, there should be an actual homicide crime attached to that in my book. Treatment is really trying to beef itself up. Inpatient is something we've never had in this community. We may have it, if we don't, we'll work with what's surrounding them. But I think the way to view this is, I think we're making some headway. I really do. And at minimum, if it's public education and less people using, then I think we've done something very, very well. But to me, this is just like the first skirmish. And we've probably got quite a few battles ahead of us. But to do it in unison with everybody is a beautiful thing for me, because I used to do this alone. And then drug court came along, and drug court helped, so there's programming out there that's designed to treat people. The difficulty is, and I'll leave you with this, treatment is only effective when folks are motivated towards it. So it's really difficult when somebody is not ready to change. You don't kick them out of treatment, but you're not always going to be successful all the time with everybody. But we get people back and back and back and back, and one of those times the light bulb goes off, and things work really, really well. And Monica will speak to that a little bit, because she's been doing this too for a long time. So I thank you for being here. I appreciate the fact that you support all that we're doing, and I just ask you to continue to support it, and wherever things happen, show up and help out. Thank you.
One question that has come up, and I know Ray has talked about this a little bit, has been this issue of there is substance abuse, and there are also sometimes the co-occurrence of mental health issues. How do we address that as a community, or are we, or what do we need to do more of?
Well, the simplest answer to it is that there used to be a theory that substance abuse stood alone, which means that was the only issue. What we found out, it took a long time for this change to occur, is a lot of people had pre-existing mental health conditions, and it got exacerbated by their substance abuse. So they're kind of set up to go into substance abuse. Most treatment agencies I have a licensed social worker and a master's in social work who help with that aspect. Oasis has allowed double licensing, which means you can have mental health services within substance abuse services. And if you don't, you have to have a linkage, like with Cayuga County Mental Health or Cayuga Counseling Services, or I think it's called. And you use those services. But clearly, to ignore the fact that you can't, you just treat the substance abuse, you don't treat the mental health, you're really doing that client a huge, huge disfavor. relapse from what we've seen, if the mental health is untreated, the relapse potential is greater.
Thank you. We'll next hear from Monica Taylor, who is with the House Behavioral Unit in Syracuse. She has been also riding the speaking circuit somewhat. She was at the college last month. She was also up in Oswego two weeks ago to talk about this. And that kind of talks a little bit about her portfolio and the size of the area. Her responsibilities include a 17-county area. And we'll ask her a little bit to describe what that 17-county area is, but also what her waiting list is a little bit about and what types of treatment they're trying to perform there. Welcome back to Auburn.
Thank you and good morning, everyone. So I definitely want to emphasize what Kevin was already talking about, the importance of collaboration, not just among treatment providers, but also across systems, because I think that's the only way that we will see changes in what we are currently seeing as the prescription drug and heroin epidemic. Krause has been providing substance use services since 1962, and we are known throughout Central New York for our methadone program, which has been in existence for about 40 years at this point. And our patients right now are from 17 different counties, so we have patients coming from as far as Watertown, Ithaca area, Auburn, and some of them have to come to our clinic 7 days a week because methadone is a controlled substance and has to be very carefully monitored, because if it's not taken appropriately as it is intended to, somebody could unfortunately also overdose, especially if they're mixing it with other drugs or things of that nature. But what it does do is, when somebody is appropriately maintained on methadone, it is really a medication where somebody is not experiencing withdrawal, they're not getting high, and they actually return to normal functioning. We have patients in our program that work, that have returned to normal lives. You would never know they are on methadone, just like somebody who is a diabetic needs insulin, they need methadone. I'm sure. Okay. They need the methadone to have a successful life.
I think if you just hold it towards you versus the audience.
Oh, okay. All right. So in our program right now, we serve 660 patients, and we also have a wait list of about 330 patients right now. Having been pretty much the only program, like I said, for 40 years, this has been a really challenge for Krause. We are very excited that there is now another program in the Syracuse area, Conifer Park, that has just opened a methadone program. And we are hearing that there are programs in Oswego County and possibly Jefferson County, and I think Herkimer County, that are looking to open programs. And I think that will really help people that are looking for treatment get the treatment when they want it and when they're ready for it. It's very challenging when you have somebody who is, using heroin or prescription drugs, and they are finally at that point where they want help. They pick up that phone that's already 500 pounds heavy, and they're being told, we can take your name and you can be put on a waiting list. Now, that is just for the medication-assisted treatment. I know sometimes people hear wait list and think that they can't get any treatment. Other treatments, like the treatments provided at SHAD or, in Krause, we offer outpatient, inpatient treatment. You can get that on demand. I mean, we can basically have somebody call us this morning saying, I need treatment, and we say, come on in, because we have a same-day access policy where we see people 5 days a week, and they can just come in and we assess them and make a recommendation. It's just for the medication-assisted treatment with methadone or Suboxone, which is another medication used where there are these long wait lists, and that's something Krause has been very much an advocate to get more treatment in our area. We have talked to both local, state, and federal politicians to get some changes in this area. We're working with OASIS. We are very open to work with other treatment providers to help open additional programs so that we can provide this life-saving treatment to people who are in need.
So, a question for you. On one of the items that you discussed last month was this issue. We envision, maybe stereotypically, the heroin addict is the guy in the alley that's shooting up, and that is not. The 1977 movie Roy Schneider is not what we're talking about anymore.
No.
But one of the items that you talked about was the number of women you see, and especially the number of pregnant women you see. Could you just talk a little bit about that?
Sure. So 75 pregnant women who were using heroin or prescription drugs looking for treatment. And we do prioritize them over anybody else. So if a pregnant woman contacts us looking for methadone treatment, they actually get to the top of that wait list because we are also now looking to save an unborn child. So last year that number was 75 compared to 2010 when that number was about 35. So we've seen definitely big changes in the demand of this treatment of pregnant women. Last year in total we admitted 260 people into our program, and what was interesting, that age group 25 to maybe 35, that's where most of our admissions were. And you're absolutely right. I mean, these are not people that live in the alley. I mean, these are people from all walks of life. It doesn't matter what your socioeconomic status is. These are individuals who have college degrees. These are successful people. I mean, nobody wakes up one day and says, I want to be a heroin addict. And I think some of it, what we are specifically seeing with the current crisis is that a lot of it is linked to the overuse and misuse of prescription drugs. And some of that is linked to what happened in the late 90s when all of a sudden prescription opiates were used for all kinds of pain management. Prior to that, it was for terminally ill people. And then all of a sudden, when oxycodone was introduced to the market, we see it being pushed for all kinds of pain management, whether it's arthritis, lower back pain. And so we saw a real shift. And I think the other thing we have to recognize as a society is that we also saw a real shift in how we manage pain in general. So around 2000, there was a new standard that requires, or that basically says, pain is the fifth vital sign. So now physicians are really in a tough spot because on the one hand, they are being told you have to manage pain and people have to be pain-free. And now they're getting all this pushback because, they're not supposed to overprescribe opiates. So I think as we look at ways to curb what we are seeing right now, we really need to focus some community education on it is okay to be in some pain. It's not realistic to be always pain-free. So I think we as consumers of healthcare need to be educated as well.
Thank you. Well, next here, next two members of our panel dealing with this. Where our first two panelists are doing this as their professional work. The next two panelists have stepped forward because of issues that have come up in their own lives and looking at the greater good of the community, have really taken on some challenges that are faced them personally and turned it into great advocacy in this community. So the first person we're going to hear from is Kevin Jones, who's the executive director of the Heroin Epidemic Action League. This has been in existence about 7-8 months now. You have seen some of their work in the community where they have done, I had this discussion last week, grave drivers in the cemetery, both at college campuses in Cayuga County, as well as at Hoops Park and City Hall. So we'll start with Mr. Jones.
I basically got involved with this because my stepdaughter, Jessica Nicole Gentile, died on May 2013 of a heroin overdose. And we didn't even know that she was using it all. We just found out that day. She agreed she was going to go to a rehab, but she went out that night and she overdosed that night. And so I started, and then a friend of mine's son, who also was a friend of Jessica, 6 months later, tried heroin for his first time after he knew that she died of it, and he died of it after using it for the first time. So we got together with a group of parents. All of a sudden, we put out a thing on Facebook. Michelle, my fiance, and I, we put it out on Facebook that we needed to do something about this. And we got 100 people at our very first meeting. And from then on, it just took off like wildfire because there's so many people that were affected by this. It was absolutely horrifying. And we started with the concept of what can we do. There's a lot of things we can't do, but there are things that we can do. We found out there's a lot of gaps in the system. When I hear people say, well, there's treatment out there available. There is treatment available, but it's like a maze to get to it because you're seeing insurance companies paying for 5 days worth of treatment and rehabs, things like that. There's just if you want to go get treatment, it's very difficult. We're actually sending most of the people that are being referred here are actually going out of state to get treatment. If you walked into our Memorial Hospital, we've had people on our website say they want to get detox and they want to get some treatment, and there's no place to detox in Cayuga County. There's just simply no place to do it. If you walked into our Memorial Hospital, you have to have a life-threatening situation going, or else they won't even touch you. And one of the main reasons for that is that Medicaid doesn't pay very well for recovery type things. And that happens on a regular basis. Like drug addicts aren't generally usually well connected with insurance companies. And the hospitals find out that 70% of the people that they're treating don't have insurance. And only 30% do, and Medicaid doesn't pay very well for that. So that's something that's, so actually if you look in the yellow pages of the phone book, you'll see there's all kinds of for-profit rehabs out there, but they even say in their advertisements, we do not accept Medicaid. And there isn't enough places for these people to go to. And we've been working on prevention, so we're trying to get into, we're into all the schools in Cayuga County. We're actually getting some from outside the county now that are coming to us because we've developed a program that we believe the best prevention is just to educate the public so that these kids and the adults and all these people know not even try it to begin with. You know, and I guess there was like almost, I didn't even know heroin existed when I started this. You know, when my stepdaughter died, I didn't even know that there was any in the Auburn area whatsoever, and we've changed that quite a bit. But we have a lot of things. There's a lot of gaps in the system. There's a lot of kids out there that are still dying. And Cayuga County, per capita, is the worst in New York State. I just saw those statistics the other day. So we got a lot of work to do. There's a lot of things to do.
So on that last item, the statistics, because we heard that, and I know Councilor Tino mentioned it last 2 weeks ago when he were at City Council. Why is Cayuga County and Auburn, why are our numbers so bad in your view?
In my view, I think it's a combination of that we don't have a recovery base for that type of stuff, and we do have people that are getting treatment now, and we're building on that recovery base. But I think a lot of things, economic factors have a lot to do with it too. And in this area, like for instance, Jessica, my stepdaughter, she had a degree from Cortland University, and then she couldn't find a job. So she was working minimum wage jobs, and so she started to get a little bit depressed. And there's, you know, it's just pretty much what it is. You know, I'm not exactly sure. It's a lot of things.
It's come up twice.
Yeah.
I was just wondering. I'd like to introduce our last panelist, Lynette Wilson, who is a real estate agent. She comes to this with a different perspective than we have normally heard in this community. I'll let her tell you her story.
Good morning, everyone.
Good morning.
I'm here because in this community, you need to see the face. The parents that are suffering and that are going through this. In 2010, that you mentioned that, my granddaughter was born in prison in 2010. My daughter is 31 years old. She's been an addict since she was probably 17 years old. My daughter has been to jail, to prison, to probably 10, 12 rehabs, detox centers. This morning she mentioned disease. If we had cancer, people would rally around. My daughter had cancer. And my neighbors and everybody rallied around and helped us and supported us. And then this disease that she has now, the heroin, the addict, we don't have it rallied around us. We don't have the support. There is nowhere in this county to get help. The last year of my life, don't get me wrong, the last several years, over a decade, has been very hard and a struggle. With my daughter in jail, on weekends, in prison, and my grandchildren born. She did drugs the entire time for both my grandchildren. I now have full custody of my grandchildren. I'm 48 years old, I've raised 3 children, and now I'm raising a 2.5 and a 5-year-old. But I'm here to tell you, the last year of my life was just absolutely horrific. She was shooting heroin underneath her toenails, in the back of her neck. She did that when she was pregnant for my grandson, so we couldn't see the track marks. When I would go pounding, this is no lie, 4 days after my grandson was born, she disappeared. And I pounded on crack houses, went around looking for her like a nut. And my sign is on my door, and the cops are like, Lynette, are you out of your mind? People know who you are, you know, you're gonna get hurt. I'm like, I don't care, I gotta find my daughter. So I can't even discuss the last 7 years of my life because there's just too much to tell you. But I will tell you about the last 3 months. My daughter was living out of suitcases and garbage bags. I didn't know where my daughter was living. So I heard it was hotels. So I went around and I went to all the different hotels here in Auburn. And I did find where she was at the Super 8 there on the arterial. Is that what it is? They wouldn't tell me what room she was in. So I just sat there and begged and cried to the lady. I said, please, my daughter's gonna die. You need to help me. But there's nothing they can't tell you she couldn't tell me. So she called me, my daughter, and she said, Mom, I think I'm dying. I said, get to the hospital, please. So she had already overdosed. She overdosed in September. She overdosed in January. I got to the hospital. We spent a couple days at the IC. Her veins were collapsed. She's down to nothing. She's just an absolute, I don't know how she survived. She got out of the hospital. The hospital found her a place, Conifer Park. This was in January. Her boyfriend, which is the father of my grandchildren, went there 24 hours later and took her because he got his income tax check. So he drove to Conifer Park, took her out of there, and back to the living in the hotels. At the beginning of March, she had, every day, just so you know, the only message I would have is, are you alive and are you okay? Because I didn't even know where she is. Where are you? Beginning of March, she called me again, Mom, I'm going to die. I really think I'm going to die. I said, please get to the hospital. She went to the hospital, and they couldn't help her. But her track marks were so infected on her legs and in her arms, they had to cut open her leg and drain it. They had to give her medication. They sent her home. I called the hospital screaming at them in the emergency room. Why would you send my daughter home? Not home, back to the hotel, wherever she was. I go, I don't even know where she is. Why didn't you tell me? She's dying. I need help. Well, she's not medically bad enough to keep her. About a week later, she called again. I was at the Owasco Park with my grandchildren on Saturday, and a guy came up to me. He said, Lynette, I want to let you know I'm the one who brought your daughter to the hospital last month. I thought she was dying right in front of me. And I just said, thank you, Dan. So the hospital called me, we got there, and she said, Mom, I really need help. And the only reason why my daughter got help is because I spent the entire day calling. I called about 20 different places, all over the place. And I found a place in Bath, New York, called Loyola, which a lot of people don't even know because it's new. It was at a VA hospital. So the hospital kept my daughter that night because I was so tired, it was so late, and it was a 2-hour drive. And I went back and I got her, and we drove that morning. And the withdrawals were just, if you've ever seen somebody in withdrawals, it's horrific. And it's when it's your child going through that, I can't even explain it to you guys, it's just very hard. So we got to the hospital, I checked her in, and I said, this is it. This is the last chance you're going to get. You leave this place, you're going to die. And you have 2 children that love you very much. So she made it through the 5 days there. Loyola has another rehab center in Hornell, New York. She went there. My daughter's on Medicaid. They only keep you 28 days. And we all know 28 days for an addict that's been an addict for over 14 years is not gonna do anything. On the 26th day, she was crying, "Mom, help me, what are they gonna do? They're gonna make me leave in 2 days." So again, I got on the internet, got on the phone calling everywhere, and the response I was getting was, the waits are 3 months, they're 6 months. You can private pay. There's one that offered, and it was $15,000 a month. And I said, "I'm sorry, I don't have $15,000. She found a halfway house, though, in Hornell, called Ann's House, and we can afford it. It's only $350 a month. And my daughter moved in there last week. She's 45 days clean. It's the first time in years that she's been 45 days clean. But you see, my daughter calls every day and she cries. She misses her children so much. And one of the hardest things I ever had to do was take my daughter's children away from her. But I had to. And I can't even imagine now having to give them back someday. And hopefully I will be able to, because I would like my life back too. You know, hopefully I will. But I don't see that for a long time. But I let her finally talk to them. She's talked to them for the first time in 5 months. And she really wants them to visit, but I don't know what the right thing to do is. I don't know, because the 2-year-old had such a hard time with it. I have them in therapy. I have them both in therapy because they had such a hard time leaving their mom and dad. So I don't know what I'm going to do. I'm going to support my daughter. I love my daughter. I'm so thankful she's alive. But I need the community to know we need help. Please. There's nowhere to go when our children are dying of this disease. There's no rehabs. There's no detox centers. There's nothing. And put this face to it and let it know it's got a stigma. It doesn't matter who you are and where you come from. It's everywhere. Thank you.
Gaps and also information. As you go from one facility to the next, there's a big gap in not only services, but in also research and the struggles that you went through to find. You mentioned Ann's House and what all. Can you talk a little bit about that?
Yeah, I just felt like there was nowhere else. I had to do it. I did it. I was the one on the phone for hours. I didn't have anybody to help me do this. And you can imagine the pain calling over and over again, all these places, and hearing the same thing. There's 9-week wait, there's 6 months wait, there's 3 months wait, and I'm yelling at poor people that didn't deserve to get yelled at, but I'm like, I need help. You know, my daughter's gonna die, and there's nowhere to go. So, I don't know. I did it as the parent. You know, I don't know what else to say. I guess when your child's in trouble, you're gonna do whatever you have to do to save their life. And we need more people to help us, but I know I will help. So if anybody has a child out there or knows somebody, I'll get on the phone and I'll make them 40 phone calls for them and help them out. And as HEAL, as members, and I'm on the board of directors as well, we'll do whatever. We welcome everybody into our group and we want to help. Yeah.
So I want to open it up for questions from the audience, but I guess really to and maybe Kevin Harris on this particular issue. We have heard the words treatment and rehabilitation. Can you tell us what the difference is between the two and how you address those?
So in terms of the treatment, that would be specific to, you know, the services that Kevin provides, the services Kraus provides, and the many other providers throughout our communities. To me, rehabilitation starts in treatment, and then when somebody is no longer getting the support of treatment, they will continue to work on their rehabilitation. I mean, it is a lifelong journey for somebody. I mean, it's not like you know, get a knee replacement, you're done with your, you know, have some physical therapy, and you're done with, you know, the disease of addiction. You really work on it lifelong.
I'm sorry, I used the wrong word. I should have said the difference between detox and rehabilitation. I'm sorry, I used the wrong word.
That's okay. So detox, or what we also call withdrawal management, is really just that initial first step that somebody would go through in terms of coming off the substances. The challenge with opioid use disorders, so somebody using prescription opioids or heroin, is that hospital-based withdrawal management units typically don't get the insurance to approve this kind of treatment. So at Krause, for many years, we operated a detox unit, and we actually closed it last year because insurance companies kept denying patients for treatment if they had an opioid use disorder. Krause is still managing people's withdrawal, but it's typically only alcohol or benzodiazepines. The insurance companies will basically say, well, somebody in opioid use disorder, they can be managed outside of an hospital. Now, we as a provider, and I'm sure Lynette as a parent, you would probably agree that it's, as you said, it's a horrific withdrawal, and it would make so much more sense to allow somebody to withdraw in a hospital where they can be managed 24/7. They get medications to manage their withdrawal, but that's the real fight that I think as a provider we fight it, and I know parents fight it, and I think it's a disservice to people. And in terms of the inpatient treatment that people receive, 28 days is actually a lot. What we see now is with many of the insurance companies, when we have somebody come into our inpatient unit, that used to be a 28-day program, but now we have people after 5 days, maybe if we're lucky after 10 days, the insurance company says they don't need this level of care anymore. And it's a real challenge. I know that the Attorney General's office is actually now looking into ways to support this. I think they've done some good things in terms of reducing the amount of denials, but what they really need to take a look at is now the length of stay issues, which I think all kinds of treatment providers are struggling with.
So thank you. Mr. Harrison, for many, many years, you were the lone guy. You were alone out there, and now the light's been shined on this issue, as well as mental health issues recently. Has that meant that it has given you more resources to streamline services? Has it given you more money to treat people because now we're talking about this?
Well, there's been no more money coming down the pipe. I mean, what Oasis did is set us up to operate like a business. So we charge insurance companies for a fee for service. But what they did is, I think Oasis is state aid to me is about 2% of my budget. The rest is what I've earned. So there really hasn't been any pouring of resources into it. And I think the other part is with Medicaid redesign and what's going on, we're actually seeing probably less opportunities to expand or add. We are going to add a counselor next month, I believe, to meet the demand, but that's all based on what we earn to cover that. I asked for a medication-assisted treatment curriculum from Hazleton. Heal has agreed to buy that for me. So sometimes we beg for things, but it hasn't really, financially, I haven't seen the response that everybody else is having. It's like you would think that would be the end result, is that the legislators and everybody would start putting money in the program, but it hasn't fallen.
And for those who don't know, you used the word Oasis a couple times. What is Oasis for those who may not know?
There are parents, the best way to explain it to you, they do the regulations and they audit your program for quality. And if you're not certified and licensed by them, you're pretty much not supposed to do any addiction treatment.
So we'll open it up for some questions. I have a lot more, but we'll open it up to all of you. Please.
I was just wondering, something that wasn't explained but I'm curious about, because last week Ignite did a community cleanup, just picking up litter and everything as a kickoff to Earth Day, and we found lots of needles in these little tiny bags that had wizard hats on them. And so my question for people in the audience like myself who are kind of clueless, what are warning signs that we need to look for how our friends and acquaintances might be acting, or physical evidence? What are those little bags? Help educate us on how to be better aware.
Start with Ms. Wilson.
Warning signs, just so you know, like my daughter, sleep. I mean, she would sleep all the time. I'd walk into her house and all the babies would be on the floor and all the shades would be and she'd be sleeping nonstop. And weight loss. I believe last summer she probably weighed maybe 90 pounds. Like I've said before, her face, when she was on meth and when she was a teenager, she destroyed her face, lost her teeth. But weight loss and her behavior, her highs and lows were absolutely, are insane. So those are some of the signs to tell. But when they stop, they sleep a lot. And she would say, I don't feel good in my stomach, the nausea, the diarrhea, and all that stuff. That's part of withdrawals is effect from the heroin.
Please.
On our website,
Which are actually our Facebook page.
on our Facebook page, we have a chart that shows the different eyes, what different drugs are taken, their dilation of eyes and things like that. My biggest thing is the drug sick because they have to sleep a lot, because anytime they're not using heroin or opiates, if they're addicted to opioids, they get sick all the time. As soon as they don't have that opiates in their system, actually most heroin addicts end up, they're just maintaining feeling normal. They're no longer trying to seek high, they're just trying to be normal. So they have to sleep quite a bit, and that was the biggest sign that I missed with my daughter.
I guess the other thing to add to that is, are you all of a sudden missing spoons around your house? Prescription drugs in your cabinets? Are there some missing? And I think that would be another call also. If you do have unused prescriptions in your cabinets, please dispose of them and don't keep them around. You also may see, especially somebody who is injecting heroin, that they're wearing long-sleeve shirts all the time now to cover track marks, even though I know the nanny said they also are getting quite creative where they shoot up. But there are certain things, I think, just being aware of somebody's baseline, and if there are things that you feel are suspicious, there's something off with that person, trust your gut.
So on the issue, well, I was going to ask about disposable. So one of the issues that you talked about was the change in prescriptions, especially to 2000. I know the sheriff, if you go to the sheriff's department, there's an area that is not camera, that people should empty their medicine cabinets. We go to the, I'm not blaming dentists, but I'll pick on the dentist for a second. You go, you get a molar, a wisdom tooth out, and they give you pain pills for 2 weeks, and you may only need it for 2 or 3 days. How has that impacted this? And I know in the sense that your group, Mr. Harris, you talked to getting out of physicians being, factories and writing prescriptions. I guess it's a convoluted question. What should people be looking at for what's in their medicine cabinet, getting rid of that, and how do we transfer from that, from opiates, to heroin?
The unintended consequence of overprescribing is there's a program called ISOP, and what happened was the government finally reacted to what I call overprescribing. And as Guy was saying, what would probably be standard course, which is a couple of days of medication, can be 2 to 3 weeks or 30 days or more. And if you present in pain, most doctors believe that, and you can get elongated scripts. So what we found happening was 2 types of folks existed. One, the folks had true pain, but developed a tolerance, so they needed more of that drug to get it, so they started doing things that are, different, which means asking for more, saying they've lost their scripts, da-da-da. And then there's another population, and this is your younger population, who felt that synthetic opiates, which is what your painkillers are safe. And as long as they come in a pill form, we're okay, because the doc gives those out. So you had those 2 forces converging, so the usage went skyrocketing, and then ISOP hit, and the doctors cut people off. And what the consequence was, it was totally unintended, is that the heroin dealers found a market. And they came in and they hit you with $10 bags, which is what you found, little glassine bags, and the needles are all related to heroin. Next thing you know, people are injecting, going crazy with this, and now we have the actual true heroin addiction going on. But I think Monica would back me out that probably 90% of those all started on a prescription medication. Because when I started, we saw heroin addicts, but they were straight heroin. I mean, they started out on heroin, and that was it. It was a small number. is 50% of my, if not 60% of my admissions now. So clearly, you cannot wipe out the prescription piece, but trying to do the right thing had backfire. And the backfire is we now have a bunch of folks who are shooting heroin, and what you're seeing is that folks will do that in any place. We've had folks overdose in a parking lot at a gas station. I mean, it's happening all over. We've had Narcan used 3 and 4 times in a night. So clearly, you know, we have a large problem because the heroin, I think, has a much greater addiction potential, and it also puts you into what I call legal boundaries that can cause you a lot of problems.
So two things that are, the public should know. One is you should not dump the prescriptions
Yeah.
down the sink because we do not need to damage the water supply.
Hit your medicine cabinets. One of the things we found is when people pass away, that whatever's in the medicine cabinet has been left there. Young people know what's in there. They can go on the internet and tell you everything that's in the cabinet. If there's a painkiller in there, you need to take them to the sheriff's department, get rid of them, then you don't have to worry about it. And then the other thing is be sure that if you get medications and they're painkillers and you need those, keep them someplace where you know where they are, or vice versa. If you decide you're done with those, get rid of them. Don't hang on to them.
And the other piece of this is in New York, you cannot return a prescription to a pharmacy. So yes, sir.
I've had a lot of people that have been affected, some suicides, and just straight died from heroin overdose. A lot of my friends it was just what Kevin's saying. They all started with like just painkillers, and they just started with something that they thought they had a handle on. And then it turned into like heroin because they didn't have any money. And then after that, it turned into the sickness. And the sickness thing, I help people get off of it. It's so disgusting that like they're shivering and they're quivering. I don't know how a mother could ever do it because like they're puking and you'll change the sheets and then they poop the pants, and it's something that like everyone has to be more aware of too. Like, and I don't mean to speak on this, but I really want to say like even if you're not affected by it, like you gotta be thinking about your grandkids. And you gotta be thinking about the kids that aren't born yet because like this is so bad. Like I was just telling these guys like it's not even bad yet. I think it's getting bad, but I think it's going to get worse. Like, and I think like if we, as a public, don't start like appreciating the Chads and appreciating like a kid that's into like just getting help, you got to promote them. You got to be like, I'm proud of you. You know what I mean? Because like it just takes a second for them to turn back the other way, and it's right in with that whole waiting time too. You got kids that want to get help, but after they wait 3 days. And they're on a 2-week wait, they don't want to get help anymore. It's just too long and they've been sick for too long. And I think if we all like start to understand that and not like, just think it's a bad thing and it's not going to affect us because it's affecting all of us now. And it's affecting all of our families. And if it's not, trust me, in about 3 or 4 years, it's going to affect everyone somewhere down the line. And I think if we build awareness to like, not only just the heroin problem, but painkillers too. It's like, it's so horrible. Like, get them out of your house. Return if you can, because like this is just. I think if we don't build up as a community and promote it as something that we're proud to be, something that's fighting this, it's only going to continue to get worse.
Well, to respond to that, because I think you hit it right on the head. There's this thing called guilt and shame. That's what drives the addict, because this is a disease. It's a health issue. It's not a moral deficiency. And having been a Chad for almost 40 years, I don't think I've seen that paradigm change. It's still viewed, and then you add the word heroin to it, which has a whole other connotation of negativity. You can't walk out in public in this town, or any town that I'm aware of, and say, I'm a recovering addict, and get people to applaud that. I've seen people lose jobs after getting recovery. So the mindset starts with this group and others, that you do look at it as a health issue, just like somebody had diabetes or a heart condition, and you react properly. But until we shift that, folks are going to be stuck in guilt and shame, and I think that's the biggest difficulty to get over for most folks.
Eric?
I'm just wondering if you see a correlation with Cayuga County being listed as the #1 in the state per capita for heroin addiction, and the fact that Cayuga County has only one provider that is licensed to prescribe buprenorphine therapy or medically assisted therapy. I mean, do we recognize the need for more, or Is there a correlation at all?
Well, the simplest answer to that is the Suboxone. We provide that. We also provide Vivitrol. Vivitrol is much more manageable because that's an injection. It's a 30-day cravings withdrawal piece that can't be manipulated. Suboxone is a great tool, but there's also a street value to Suboxone. So what we're finding is doctors are not jumping in, because I don't think there are more. I know Dr. Danello, who is our doctor, is, and I think Dr. Duckett is, but I think they're the only two doctors, other than maybe Dr. Surfer up at the hospital, who have their DEA certificate to provide Suboxone. But I do know that that's a lacking piece, because folks need to look at that, because one of the things with treatment for me is I don't care how you get it, whether you got it in Chad, whether you got it at the local doctor, whatever it is that works for you works. But the Suboxone piece is still a work in progress. And Vivitrol, for example, the sheriff and county mental health and I and different people are working on a program at the jail where if you get clean in the jail and you're getting ready to leave, a Chad counselor would assess you, and then we would give you Vivitrol prior to leaving the jail, and then have a hookup at the agency for when you get out. So I think there's more movement in that area, but I still think it's in its back stages because the medical society hasn't really wrapped their head around it.
Yes, sir.
Can I just offer hopefully a couple of suggestions and solutions to some of this? I used to run these programs many years ago, psych and substance abuse programs, and one of the ways in which you can really make a change is you need parity between medical and psych and substance abuse. You look at all your insurance plans. The insurance plans, cover all the well baby visits and all that kind of stuff, but when it comes to the substance abuse and psych, it's terrible coverage. And I'm not trying to blame the hospitals or blame the insurance companies, but if you really want to make a sea change, you got to lobby your employer, your insurance companies, and your politicians to create parity between those things. That will open the doors to some of these solutions. Secondly, cost effectiveness is part of this. We did studies specifically on alcohol, where alcohol treatment, successful alcohol treatment, really dramatically reduced the amount of medical expenses that people incurred. And unfortunately, when we presented this to the insurance companies, these were national insurance companies, they weren't that interested because they told me, quote unquote, the cost benefit I presented was like 2 years. They said, well, our average person is only there 19 months. And I literally wanted to choke the guy. But these are some of the problems. You need parity and proving cost effectiveness for the treatment. And I think that might help you. Also, the numbers of treatment facilities, I think, like closing down Benjamin Rush and other kinds of places, has really negatively impacted your ability to get services. I just use that as one example. But anyway, those are a couple of comments.
So just to finish up, please comment, and then I'll finish up because we're close to 9 o'clock, but please. Yeah, for cost effectiveness also, it's like 50% of our prisons and jails are actually drug-related charges. So if there was some type of a better treatment program, drug courts going to treatment instead of going to actually lockup treatment, long-term treatments, instead of actually taking them, putting them in a rehab so that they get back out again, they go back into prison over and over and over again. That's costing us a fortune. So if anybody's thinking, why should I care if your kid sticks a needle in his arm? We're out, man, in a lot of ways. Go ahead, either side, and then we'll finish off.
Well, and when my daughter spent a year in prison, that could have been the chance that she got the help that she needed, and no intense programs, nothing, you scrubbed your toilets and went to your room or did whatever you had to do. But what I'm saying is it's a shame that they don't have better programs, because maybe that 1 year, if she had the treatment that she needed and when she was gone, it would have been a difference now, but nothing.
Ms. Taylor.
So I know we're here to talk about the prescription drug and opioid epidemic, but I think it's also important to not forget that there are many other substances that are an issue for individuals. And even though right now this is about 50 to 60% of our admissions, as Kevin said, but we still have about 25 to 30% of individuals seeking admission for alcohol use-related disorders. And April is Alcohol Awareness Month, so I felt I needed to at least put that out there as well.
So, Mr. Jones, I know you have an event in July. Can you just tell people quickly about that and then I'll finish?
Yeah, July 9th, we're going to be doing a 5K run, which is, actually it's going to be, what is it?
UV splash. It's at Casey Park on July 9th. We're having a UV dash, and it's a great family event, and the runners will run about 8 o'clock at night, and you will be splashed with neon colors. So it's like the dash that they had up at the high school last year, and our goal is to raise money for our HEAL organization. But it will be, my sister Julie Howard will be singing. We're looking for guest speakers, and but there will be things for the children to do. There will be food and bounce house, and it'll be a great family event. So we're really looking for teams, and we're looking to people to come out and sponsor and help and join us.
Thank you. We'd like to thank all of you, Lynette, Wilson, and there are, out by the door, there's information on heroin meetings and some of the work that they do. We can't thank Monica Geller enough for coming back to Cayuga County to give us an update, and Kevin Harris for being the utility player who is doing the long haul. Thank you all for that. Just two final programming notes. If you would return your name tags, Jesse will track you down. Also, I think there are surveys on your desk, and then we will, or the table, and then we will be back next month for our final panel, which will feature Andrew Fish, who is still here in a different capacity, as well as Rob Simpson on economic development. Have a great afternoon.